We will now show you how to set the ICU case default, how to set the FR2 and the flow. Once you have completed a full check or left the standby screen, you arrive at this screen. Press the Adult button and choose ICU from the drop-down menu. This will open default settings for alarms and ventilator for intensive care use. You can also enter the patient's ideal body weight and age, but I suggest to do this later. You can now press Start Anesthesia. This starts the fresh gas flow into the circle, but please note that it does not start ventilation. The bellows are not moving and neither is the patient's chest. Let's now look at the fresh gas flow into the circle. It is visually represented on the screen with two flow meters, one for oxygen and one for air. Below the flow meters we can see the total flow and the FR2. We can adjust the FR2 by pressing on the square and then choosing either one of the pre-configured buttons, or we can use the green wheel by pressing the square again, moving the wheel to where we want it and then confirming by pressing it. The machine will default to 100% oxygen and a total flow of 10 liters per minute. We are not using soda lime for intensive care ventilation and we need a high fresh gas flow to prevent rebreathing of CO2. We recommend a total fresh gas flow that is equivalent to the patient's minute volume plus 50%. In most cases this will be somewhere between 8 and 12 liters per minute. Let's talk about ventilator modes. The machine initially defaults to volume control ventilation. Whilst we occasionally use it, it is not our standard mandatory mode. Touching the little square opens the mode menu. Our default mode for mandatory ventilation is PCVVG, which is similar to PRVC on our Mackay ventilators. Our default spontaneous mode is CPAP PSV, which stands for pressure support ventilation. To choose PCVVG, we press the button and then need to confirm the tidal volume. It defaults to 425 milliliters. The other parameters default to the values shown. We generally aim for tidal volumes between 6 and 8 milliliters per kilogram ideal body weight, a respiratory rate between 14 and 18, an IE ratio of 1 to 2, and a PEEP somewhere between 5 and 10 centimeters of water. The maximum pressure allowed can be adjusted when pressing more settings. We are now finally ready to attach our patient to the breathing circuit. In order to commence ventilation, we now need to flick the green switch from the manual mode on the left to automatic mode on the right. We then need to check that the patient's chest is rising and that our bellows are full and moving. We also need to ensure now that our fresh gas flow is adequate. We generally try and keep the inspiratory CO2 below 0.2. If the inspired carbon dioxide rises above 0.5 kilopascal, the machine will sound an alarm. If the inspired carbon dioxide is greater than 0.2 kilopascal, you need to increase the total fresh gas flow by 1 liter per minute. You may have to repeat this until the inspired CO2 remains below 0.2 kilopascal. Our default spontaneous mode is CPAP PSV. Our patient is currently in a PCVVG mandatory mode, but you can see that he is interbreathing. All triggered breaths are indicated by a change in color on the pressure or flow time curve. In order to change the patient to CPAP pressure support, you press on the mode button and then select CPAP PSV. Now the pressure support needs to be dialed up and confirmed by pressing the wheel. The PEEP level will remain the same as in the previous mandatory mode, or if CPAP is chosen initially, it will default to 10. The pressure support is triggered by a flow trigger, which is set to 1 liter per minute as a default. This is slightly lower than on some other ventilators, but we have found the Aisys CS2 to be a little insensitive. A value needs to be set for a minimum respiratory rate. On this machine, CPAP and PSV has no apnea backup mode. Instead, the machine measures the patient's own respiratory rate, and if it falls below the minimum rate set, it supplements the patient's own breaths with intermittent pressure control breaths. A sensible rate to choose is probably somewhere around 8. Under More Settings, you can adjust the end of breath percentage of peak flow. That is the same as the cycle off threshold on the Mackay ventilators. That basically determines when the spontaneous pressure supported breath ends. This will rarely have to be adjusted. You can also set the inspired pressure for the pressure control backup breaths and the maximum pressure allowed, which defaults to 35 centimeters of water. This patient is breathing at a very fast respiratory rate, much higher than the minimum rate set of 8. In that case, the ventilator will not provide any pressure control breaths. But let's see what happens when the patient stops breathing. There is no apnea alarm and no backup rate, but the ventilator will now try and achieve the minimum rate of 8 with intermittent pressure control breaths. And you can now see them on the screen. Although it is tempting to just press End Case on the screen, ventilation can only be stopped by flicking the green switch to the left. Whenever we switch to manual, it is good practice to always ensure that the APL is fully open. If we now want to truly end the case, we press End Case on the right bottom corner and we confirm with End Case now on the left-hand side of the screen. This now switches the ventilator into standby mode. This is the end of part 4. Please watch part 5 for troubleshooting.